Hello and welcome to Quinn's Harm Reduction Based Education. In this session, we'll take a look at safer injecting practices. It should be noted, however, that prolonged injecting over time can cause serious health implications. Alternative routes of drug administration should be discussed and considered. Today we'll learn how to reduce damage to your veins, we'll explain the difference between veins and arteries, and we'll look at things that can be done to reduce or avoid dirty hits and infections. This will include a discussion around wheel filters and their uses for different substances. Injecting into a vein can sometimes cause damage. This is usually because of repeated injecting in the same site. The vein can then become irritated and the internal lining of the vein swells and can collapse, which can stop the blood flowing through it. Often by not using that vein for a while, it can recover, but sometimes the damage can be permanent. When a needle is inserted into a vein, a small clot can form. The more injections into that site increase the forming of clots. Over time, the vein can become blocked, which then turns into scar tissue. Often you can feel a lump at the site of injection. Scar tissue shrinks and contracts the vein, leading to the vein collapsing. To minimise vein damage, it is important to rotate your injecting site often. There are important differences between veins and arteries, and when injecting substances, we only want to inject into a vein. Venous or vein blood is dark red and travels at a lower pressure towards the heart. Veins form a complex network with many junctions and can be deep in the tissue or close to the surface of the skin. If a vein becomes blocked, blood can find its way through a smaller vessel further back down the system. It is when these smaller vessels become overloaded with blood that swelling can occur in the hands or feet. Arterial injection can happen accidentally, usually when someone is trying to find a deep vein, such as the femoral vein. If you can feel a pulse, you've found an artery and you shouldn't inject there. Arterial blood is bright red and travels at high pressure away from the heart. If you hit an artery by mistake, you should immediately withdraw the needle and not complete the injection. Put strong pressure on the site for at least 15 minutes, raise the affected limb if possible, and seek medical advice. There are things that we can do to reduce these risks while injecting. Where we inject is very important, as some places on the body are considered high risk. Injecting into the neck or groin area is dangerous due to major arteries sitting close to veins. Injecting into a major artery can cause internal bleeding and even death. Avoid injecting above the shoulders, below the waist, and into hands and feet. Always inject at an angle towards your heart and use a new sterile needle and syringe for every injection. These are available free of charge from your local needle and syringe program. Rotating your injecting site gives your veins time to heal. If you notice redness, swelling, or signs of infection, seek medical advice as soon as possible. Talk to our harm reduction workers at Quinn or go to your local needle and syringe program to get information and advice on safer injecting practices, other routes of administration, and other info aimed at keeping you as healthy as possible. As discussed, it is very important to ensure you use a new sterile needle and syringe every time you inject. It's equally important that you don't share any equipment, including spoons, tourniquets, and drug bags. Sharing equipment can expose you to blood-borne viruses such as hepatitis C and HIV, and it also increases the risk of bacterial infections. Use good hygiene, such as washing your hands and cleaning not only the site you inject into, but also the table or space you are using to mix up and prepare your drug mix. Your local NSP can supply sterile water at a small cost, and you can always ask for extra swabs for cleaning. Always use a new sterile cigarette or wheel filter in every new mix. Some syringes come in a variety of colours, which makes them perfect when injecting with other people. Choose your colour and stick with it, and ensure your partner or friends have a different colour. This stops people accidentally picking up someone else's syringe. Always dispose of equipment in a puncture-proof container and return these to your local NSP for safe disposal. When someone has what is known as a dirty hit, It can cause a variety of symptoms such as vomiting, fevers, chills, sweating, and headaches, which can sometimes be severe. A dirty hit can be caused by particular compounds in the drug itself or by dirt or bacteria that has made its way into the drug mix. This makes it especially important to filter your drugs and keep your injecting space as clean as possible. Dirty hits can also be caused by reusing injecting equipment, even your own. This is why it's important to ensure you have an extra supply of injecting equipment, so needles and syringes don't need to be reused. Another injecting-related risk includes endocarditis. Endocarditis is a life-threatening condition that is caused mainly from bacteria from our skin and infects the valves of the heart. Symptoms include fever, rashes, irregular heartbeats, breathlessness, stomach or joint pains. It is very important to seek medical help immediately, as endocarditis can lead to heart failure and death. Another risk includes septicemia. Septicemia is caused when bacteria enter the bloodstream and creates a serious infection. This can cause kidney failure and shock. Because of problems with vital organs, people with severe septicemia are likely to be very ill and the condition can be fatal. However, septicemia is treatable if it is identified and treated quickly, so it is important to get medical help quickly if you think you could have septicemia. Wheel filters, aka pill filters, are available from primary needle and syringe programs for a small cost. Some wheel filters remove bacteria, chalk and wax from illicit drugs and prescription medication. Tablet medication such as morphine and benzos contain binding agents that can cause infections, abscesses, vein collapses, dirty hits, and endocarditis when injected. Talk to your needle and syringe program worker about wheel filters. They can demonstrate how they work and help you choose the correct wheel filter for the drug that is being injected. Injecting drug use carries numerous risks that can impact your health. It is important to reduce these risks so that you can maintain your health and well-being. Quinn staff are happy to provide support and advice around keeping you as healthy as possible, so don't be shy. Speak with your Quinn worker today. For more information, please contact Quinn by visiting www.quinn.org or calling 1800 172 076, or simply visit one of our needle and syringe programs.